Good morning, everyone. This is Bob Howard from St. Michael's Hospital, part of Unity Health Toronto. And I'm here with Dr. Matthew Muller, who's an infectious disease specialist at St. Michael's and also the medical director of infection prevention and control at the hospital. Matthew's been working for months now on the coronavirus issue, has tremendous expertise and is here to answer a number of questions. So I've got a list of questions that I'm going to propose to Matthew that hopefully will enlighten everyone as to where we stand with this disease as of today. So with that, I will begin the first question. Matthew.
What is this virus, coronavirus, and maybe just say a little bit about why is this different than flu? Everybody knows about the flu virus, but this is not the flu virus, and maybe a little bit about how or why they're different, Matthew.
Sure, absolutely. So I think everyone's aware that this is a virus that emerged in Wuhan, China, and the best theory right now is it's emerged from an animal reservoir. We call it a zoonotic disease, and so it jumped from animals to humans. And after that, we weren't sure what would happen, but it's become clear that it's capable of spreading aggressively through human populations, unfortunately. So it's now spread globally. This is not the first coronavirus that we've had to deal with, but it's different than what we've seen with other coronaviruses. So there are a few common coronaviruses that can cause a common cold scenario, and then MERS and SARS are more severe coronavirus diseases that also came from animals over the last 20 years or so. The difference between this coronavirus, or COVID-19 as we're calling the disease that it causes, is its ability to spread from person to person, which is quite different from SARS. So the SARS outbreak was relatively easily contained once it was recognized and a diagnostic test was available and public health interventions were put in place. And so it actually didn't, although we were hit hard by SARS in Toronto, it didn't spread all over the world. So at the beginning of this outbreak, people thought that COVID-19 might be a little bit like SARS, and it hasn't been like SARS in this one way, which is concerning, which is that it's spreading much more aggressively. It's been better than SARS in that about 10% of patients with SARS died. So SARS was a very serious and very severe illness. So then we started thinking maybe this is more like flu, because flu is a respiratory virus like the coronavirus that is capable of spreading around the world in a short period of time. But there are important differences with the regular seasonal flu that we see. And I think the biggest one is that the coronavirus is still a lot more severe than the flu. So one big difference is that with flu, we talk about a case fatality rate of about 0.1%, which means about 0.1% of people that get the flu may die from the flu. Speak a little louder, sure. And for the corona, should I hold this up? Is that going to be better?
Yeah.
Okay. So I'm holding up the microphone, and I hope that helps my voice project a bit more. But the mortality from the coronavirus is still not fully known. It takes a bit of time to figure that out, but it looks more like it's 1 to 2%, which is much more severe than regular seasonal flu, and much more severe even than the last pandemic flu, and looking a little more like the Spanish flu of 1918 that people are always talking about. So I think that's where the big concerns with this disease are, is that it's both capable of spreading fairly aggressively, but still has a mortality that's substantially more than flu. The one piece of good news is that for reasons that are still not fully understood, it does not seem to cause much in the way of disease or severe disease in children and teenagers. And so that group, especially very young infants, can be hit hard by flu, but the coronavirus seems to not really affect children too much at all.
So Matthew, along the same line, so how is it spread? How does one catch coronavirus?
Yeah. So again, for all, I won't repeat this with every answer, but we're learning about the coronavirus. It's a new disease. We didn't know about it in December. We've actually learned an astonishing amount about it in a short period of time compared to previous diseases like this. What we know so far is it appears to spread by droplets and by contact. The best evidence is for this droplet spread, and that's essentially somebody within 1 to 2 meters distance of you who's coughing or sneezing, potentially even breathing in some cases, but likely mainly from coughing and sneezing, and it gets onto your face and essentially you have to breathe it in, get it in your nose, or potential exposure to your eye could do that as well. So that's how it spreads is by droplets. Most of the transmission in China, where we've been studying it for the longest, suggests that the vast majority of transmission occurs within households. So these are people that spend a lot of time together and a lot of time in close proximity. The other way that it may spread is through contact. And so again, that can happen by shaking hands, but also potentially environment that we don't like survive on the environment. But clearly, you know, when you sneeze and you use a tissue, you need to wash your hands after that. And when you have people shaking hands and touching each other, we all tend to touch our faces. So if your hands get contaminated, then your face can get contaminated, and that likely is another way that this can spread. Although droplets travel through the air, when we use the term airborne spread, it's a technical term, and that usually means something capable of being suspended in the air that might travel more than 3 to 6 feet or 1 to 2 meters. And there's currently no evidence that the coronavirus spreads in that way.
So back to the surface issue, how long can coronavirus live on a surface?
Yeah, based on other viruses, we would guess that it would not be a prolonged period of time, so in the range of hours and maybe a day or two, but we don't have good data yet on the coronavirus. So that it clearly does contaminate surfaces when you have an actual in a hospital room, for example, and environmental cleaning in the hospital is very important for that, but we don't have the full answer to that yet.
So it can stay alive on a surface for quite some time, like a day, maybe.
Maybe. I'm speculating there a little bit, and we haven't really seen that type of transmission. Again, in the household transmission, that may be part of what's happening, right? People are sharing dishes and utensils and touching the same table and doorknobs and so forth. But we haven't seen a lot of cases where somebody mysteriously gets it and we don't know where, and maybe somebody touched something on the subway. In fact, transient contact does not appear to transmit the coronavirus. We're not seeing other people on the plane getting coronavirus. We're not seeing people in public transit particularly getting coronavirus. It's been people like healthcare workers and then close family members who spend 10, 15 minutes or longer with the individual in most cases.
So that leads into the question of just how do I protect myself?
Yeah. Oh, now I'm too loud. So there's different strategies for healthcare workers and for the public, but I think what the public can do is still very important. What we can all do to protect ourselves actually contributes to controlling this epidemic in Canada and beyond. So the regular advice everyone gets is frequent hand washing, and I think that's absolutely reasonable advice. So before and after preparing food, after going to the bathroom, but also maybe after being in a crowded environment where you may have been touching many things, or if you happen to be around somebody that's sick, then washing your hands is a great idea if you have a family member that you're caring for or somebody at home that's sick. Covering your cough is going to protect other people, and that's important. I think increasingly what we really would like to see is people staying home who are sick, even if you think you just have allergies or a mild cold. Remaining at home until that is better is going to be very important for the public good to reduce the transmission of this. Avoiding people when you can that are unwell is also a good idea. Avoiding coming to work in public places and hospitals when you're sick. And so those are all important strategies. The new thing that everybody's talking about, which I think is going to be very important for the control of this outbreak overall, is social distancing. And so at Unity Health, we've released some guidance on this, and we're going to release guidance for our staff to cancel, for example, large meetings and to consider when things can be done virtually rather than in person. And so everyone's aware of the news that sporting events are being shut down, schools are being closed. And I think that we're not saying that you can't see other people at all, but by avoiding large groups, you minimize the risk. And the way that works essentially is if you have one person with coronavirus in a group of 100 and they all get together, that one person may spread to 3 or 4 other people within that group. But the other thing that can happen is the whole group could be quarantined, because once it's recognized that that one individual was there, it can be hard to know who they had prolonged contact with. If you had 10 meetings with 10 people and there was still that 1 in 100 case of coronavirus, 9 of the meetings would be fine and there would be no issue. And in the other meeting, there might be 1 transmission and 8 people that need quarantine. So by doing more small group activity and less large group activity, and by social distancing, other strategies are to sit every other chair around the conference table, to book a bigger room for smaller groups of people. And we're encouraging all those things at Unity.
So what about travel?
My advice on this has been evolving daily. I think right now is a bad time to travel, period. I think that's my honest advice to people. You can travel to France one day thinking that the problem is in Italy, and the next day it's in France. You could travel to somewhere else in Europe thinking that you'll be okay there, and then all flights are canceled back to the U.S. For a variety of reasons. So there's all kinds of pitfalls with travel, including an increased risk of being ill if you're in a country where this is a problem, as well as just other disruptions and unpredictable things that may happen either while you're there, preventing you from getting home, or quarantine when you arrive home. It's also going to, we've done very well in Canada compared to many other countries so far in recognizing this early and getting ahead of the curve. And by limiting the number of people going back and forth from Canada to almost every other country actually has more coronavirus than Canada at this point, we can lower the risk in Canada, at least for a period of time. There may come a day when the floodgates have opened here as well. We want to slow that down as much as possible, and people talk about flattening the curve. So it's not only delaying the outbreak here, but it's also important to have a longer outbreak with a lower peak. And that makes sure that we don't put a strain on healthcare resources that we can't handle at any given time. So to get it, if you're going to have 1,000 people requiring intensive care with coronavirus, if you can have 200 a month for 5 months, that's better than 1,000 in 1 month. And so right now, it's really important to try to think about limiting unnecessary travel. We can't shut down borders completely, and the essential goods and services need to cross the border. But I think people should think twice, particularly about recreational travel.
So I think one of the important things for our audience here is actually the United States, right? So a lot of our people on the line here probably have homes in the United States and are moving back and forth all the time. It's kind of their normal life. What about any advice for them?
It's a good question. It does seem to be a much bigger problem right now in the U.S. Like I said, we're very connected with the U.S. It's not only the board members who travel back and forth, but somebody told me the number of people that go back and forth a day, and I think they said 400,000. I'm still not sure I can believe that. But what's a problem in the U.S. will eventually be a problem here, perhaps sooner rather than later. So in the future, this advice may change. Right now, I might encourage staying in one place rather than the other, whichever one it happens to be that's most most appropriate for that individual. Obviously, travel has not been banned between Canada and the U.S., but there's certain hot spots in the U.S. where this is a much bigger problem than it is anywhere in Canada. And they've also really been struggling with testing in the U.S., so they may not know where other areas of coronavirus.
I'm going to come back to the testing issue, but I guess one of the points is if you get sick in Florida with coronavirus, you're not coming home. I assume you're not able to come. They will not let you come home until you're well. Is that likely true?
So absolutely, if you're honest and open, which we all should be, about the fact that you're feeling sick, or if you in fact are confirmed to have coronavirus, you shouldn't be on a plane going in any direction. But yeah, for sure, if you're diagnosed with coronavirus, you will be in isolation, likely for a prolonged period of time, several weeks.
Yeah, so that's wherever you happen to be when you get it, which is, I think, an important issue. So I want to move on a little bit and just talk about if I catch the virus. There's a bunch of questions around that. So the first is, do we know what the incubation period is? How long before, the contact and when I actually start to get symptoms?
Right. So one of the challenges is that in areas that have been hit in the U.S., but particularly places like Italy or Iran, or where there's a lot of the virus circulating, you may not know when you were exposed, right? So the incubation period is only helpful if you know that you had an exposure on a certain day, or if you've traveled. So if you travel from a high-risk place to a low-risk place, when would you expect to be in the clear and away from the virus? And the incubation period seems to be about 2 to 14 days. So the earliest people tend to get sick is 2 days after being exposed, and the longest is probably 12 or 13 days. And so we've been saying 14 as to be cautious
for the quarantine.
Well, it's 14 for the quarantine, but it's 2 to 14 days is what we say is the incubation period. So if you know that you have a patient with a person with coronavirus that you're sitting with and they're coughing on you, and you find out that on Tuesday you were sitting there with somebody with coronavirus, 15 days later, if you're feeling well, you didn't get it from that person and you're in the clear. But up to 14 days, you still could start to exhibit symptoms. Most people get sick around 5 to 6 days after an exposure.
Okay. What are the symptoms?
Yeah. So the symptoms, unfortunately, are very similar to, depending on the severity, any type of cold, flu, or pneumonia, depending on how severely ill you are. So it often starts with a dry cough, a bit of a sore throat, a small number of people may have a runny nose and aches, pains, fatigue. The main symptoms are really cough and fever. So the fever may come a little bit later, however, and then as it progresses, you may develop shortness of breath, and in the more severe cases, you may have some trouble breathing, and that tends to be what brings people into the hospital.
If I get it, how long will I be sick?
Yeah. So again, the children who are exposed either don't seem to get sick at all, or may be sick for a very brief period of time, and there are many adults, including people that are older, who may have a 1 to 2 day illness and not feel particularly sick. There are others who are sick for a week and then get progressively worse and then end up in hospital for several weeks. And so it can really be anywhere from a 1 to 2 day mild illness to a 3-week ordeal in the hospital.
So in that regard, how long am I actually contagious as part of being sick? So sometimes with a flu virus, you get sick and the virus is then gone, but you continue to have mucus production, that sort of thing, but you're probably not infected anymore.
Yeah.
So how long, if I get the virus, how long am I, you can be sick maybe for longer than actually you're,
right.
Is there any sense for that?
Sure. So the first thing, just to answer a slightly different question, we do think that it's contagious very early in the disease. So, possibly just before you recognize that you're sick. And that's really why we're encouraging people, even with mild symptoms that, and I think everyone's had that where you wake up and you feel maybe you didn't sleep well, maybe your allergies are acting up, but then 12 hours later you're at work and you realize that you actually feel really crummy and this is the flu that's starting. So we're asking people to really reflect on those early symptoms and avoid group gatherings or coming to work when they're not sure if they're sick or not, because it's likely that you're highly contagious at that point in time. We don't know how long people are contagious, and so for the confirmed cases that we have in Canada, and I think this is similar to what they're doing in many countries, we not only wait for all the symptoms to resolve, but we're repeating your coronavirus test. And we're finding that the test remains positive for a long period of time, and people are deemed non-infectious when they have 2 consecutive negative tests. But that may be even weeks after you feel fine.
So I'm going to come back to testing in a second, but what's the likelihood that I actually will need to be hospitalized?
Right. So overall, we're getting somewhat different estimates from the Chinese experience and the Italian experience, where we have the most data, but it's looking like 5 to 10% of people require hospitalization for COVID, and then a proportion of those, maybe 25% of those hospitalized, up to 50%, may require critical care in the hospital. So the majority of people don't, but it's still, from a health system perspective, and even to some extent from an individual perspective, it's an alarming number to some degree. And the risk it's not that everyone who's over a certain age will not have a mild disease or will have a severe disease, and everyone who's younger will be fine. So there have been severe and fatal cases in younger individuals, like in their 40s and 30s, and there have been people in their 60s who have a sniffle and a fever for 24 hours and are better. But statistically, the older you are, and in particular, the sicker you are at baseline. So if you have diabetes, high blood pressure, heart disease, other types of pulmonary disease, COPD, then your risk of being hospitalized is considerably higher, and the risk of severe outcomes is higher. But it's still unpredictable, and there's this element that we don't understand, and there's a statistical part of that. So with the exception of children, really, severe disease can occur to anyone, but the likelihood is
But it's a gradation. So when people talk about the mortality, they're talking about the average mortality over the whole everyone that gets it. But depending on your age group, that's actually can be quite different. So if you're
it's not
quite young, it's almost zero.
Yeah.
And if you're elderly with comorbidities, it could be as high as...
Yeah, it's not a linear thing. So if you go, the risk increases a bit from 45 to 65 if you're healthy. from 65 to 85, it increases quite a bit. So when you're above 85, this is an extremely severe disease. I'm not sure if I can give you numbers, but this is the group, say, in long-term care facilities who would not only be older, but also would have other illnesses in many cases where, you know, we may see very high mortality from this disease, like 20% or higher.
All right, so thank you for that. So I want to move on, and we maybe come back to some of these things, but how is the diagnosis made? And of course, if you watch CNN, all they talk about is the fact that they don't have enough tests, so they're not testing people because they don't seem to have testing kits. So we'll kind of get to that, but where do I go to get a test? If I think I have it, like,
right,
how do I get diagnosed?
Yeah, for sure. So that's going to be changing in Ontario to make things a little bit more complicated. But there's lots of people who are convinced that they have it and don't. And even now, there's still, you know, orders of magnitude more likely in Toronto that you have the flu or many other respiratory viruses. So right now in Toronto, if you have a flu-like illness and you have not traveled and you have not cared for somebody with coronavirus, known to have coronavirus, and you show up, say, at your family doctor or the emergency department, you would not be tested. So for mild cases who have not traveled, we're not testing. The access to testing is not infinite in Canada either, and of course the U.S. is now purchasing everything they need to do as much testing as they can, and so there's going to be global shortages of different elements that are required for testing, so we do have to be judicious with the testing, and so it's going to be prioritized in Ontario as well to either more severe cases requiring admission or on the outpatient basis to people where there is a more obvious risk. So for example, if you came from an affected area and you have more symptoms, I think right now we've been testing travelers pretty liberally. So if you turned up at an emergency department with fever and a travel or cough and travel, many areas have been testing, but I think over the next 24 to 72 hours, that's going to change. And people who are sick, but the illness is mild, are simply going to be told to stay at home and stay at home till you're better. And the rationale there is really that there isn't a treatment for this yet. There's not a specific antiviral drug. And so knowing that you have, I mean, people want to know, and I fully understand that. I think we would do it if we had an infinite number of tests, but it doesn't really change the advice that people are going to have to take. And so if you really just have a runny nose and you were in Florida, they're going to tell you just stay home till your runny nose is better, and then and maybe a little bit longer than that, and then resume your daily activities. But the way to find out in Toronto right now is to call telehealth. If you're sick and you're at home and you're not too sick, is to call telehealth, call your family doctor, or call public health, and they will get back to you and they will give you an answer in terms of where you should go for testing or if you should go for testing. It may take many hours to get that, and they're trying to ramp up their phone resources to bring that number down, but it is a bit of a long wait. I hate to tell people though, because the emergencies are swamped, and you may wait there for a long time with other coughing and ill people and then be sent home again without testing. So even here, it's becoming a bit trickier. But we have been doing a lot of testing, which has reassured us that it's not widespread in the community here yet. But again, there's lots of traffic between Toronto and many other places with significant amounts of coronavirus. So we anticipate that things will get worse, and it seems to change on a daily or weekly basis.
My understanding, Matthew, is they're going to be opening testing centers.
Right, and that's what I was alluding to as some of the changes that are going to happen going forward. So there are going to be assessment centers opened across the city, including at Unity Health. The intention of these centers is that they're not going to be like a walk-in type one-stop shop for if you're worried about coronavirus, because they're worried about thousands of people coming who really are the worried well and have a runny nose for some other reason and they haven't traveled or don't have risk factors. So my understanding right now, and they're still working the details out over the weekend with the plan to open some of these assessment centers on Monday, including our own Unity Health centers, is that you would be phoning in to some type of hotline where they might realize that you're quite sick and tell you, you better go directly to Emerge, or they may realize that you're quite mild, and if you go to the assessment center, they're just going to tell you to stay home. But if they think that you're somebody who merits an assessment because they're not sure, either they're not sure how sick you are, or they think that testing in your case would be important, those are the people that they're going to send on to the assessment center.
So what is the test?
Yeah. The test is what we call a PCR test. It's routinely used in medicine and infectious disease for diagnosis of many infections. And basically, it's a Q-tip that goes up your nose to get some of your respiratory secretions or mucus on the Q-tip, and then it gets sent to the lab, and the PCR detects the genetic material of the virus.
How good is the test?
Yeah.
I mean, if you actually have the virus, is it always positive? I mean, I guess, are there false positives? Are there false negatives?
So PCR tests in general tend to be quite good. A test is always a little bit operator dependent. So, there's been some talk about self-testing, but when healthcare workers stuff the Q-tip up your nose, they tend to stuff it a bit further than the patient will on their own because it's quite, it is a little bit, it's not painful, but it's a little uncomfortable and unnatural sensation. So, you need to do the swab properly, obviously, or the result may not be what you expect. And there's different tests. So the test being used in Ontario initially was all done through the Public Health Lab of Ontario, and they validated it with the World Health Organization and the National Microbiology Laboratory. And I think that test is very, very good. If it's positive, you have COVID. I don't think there's any doubt about that. If it's negative, it's still, there's a bit of a depend. So we've heard in the media about people getting tested when they, for example, been on a cruise ship and they don't have any symptoms. That doesn't really work. And so even if you're incubating COVID, so you're going to, if it's Monday and you come off the cruise ship and you're going to get sick on Friday, if they test you on Monday or Tuesday, it's quite likely to be negative. And that does not mean you will not get sick on Friday. So there's really no reason to get tested if you feel fine, even if you think you may have been exposed on a cruise, seen somebody with COVID at a party. You really need to wait either 14 days to know that if symptoms didn't develop, you're not going to get COVID, or if you start to feel sick, that's when you would get tested. So if you're sick when they do the test and it's negative, it's a pretty good test. It's not perfect, but it's a pretty good test. But if you test too early in the disease, that you could get a false negative. So
I think that's important for people to understand that, just because you were, shook hands with somebody a day later getting tested is not helpful.
It's absolutely, it's not, it's a waste of resources because we have limited tests both in Canada and the US, but also because it gives you a misleading result that could be falsely reassuring.
So I think you answered this a little earlier on. If you have a positive test and you go through the, recovery at home and so forth, and you become asymptomatic, you're saying that all of those people who are positive need to be tested again. Is that right? We're going to test all positives to prove they're negative at some point. Is that right?
Yeah. So in Ontario, with the positive cases we've had, you do not need to remain in the hospital or even be hospitalized at all if you have a mild case of COVID or if you had a more severe case, but now you're feeling better. So you can go to your home, but you would be asked to self-isolate in the home. And while you're self-isolating, public health would be in touch with you, and at appropriate times, they would actually come to the home and repeat the testing. And after testing you twice and getting 2 negative tests in a row, then they would tell you to go about your regular business. But until then, they're asking people to stay at home.
So 2 negative tests.
2 negative tests, yeah. And it seems to be taking quite a long time to get those 2 negatives. So you may actually be feeling better for a week or two, and your tests are remaining positive. We don't know for sure how infectious you are, but we're not taking any chances with those individuals.
So the length of this illness, in terms of the time, if you get the virus, how long you're likely to be sort of quarantined, if you like, is what?
Yeah, so I think we're looking at it, like I said, the illness could be very short, but in the longer illness, it could be 2 to 3 weeks of illness and then another 2 weeks before 2 to 3 weeks before you're cleared. So even a 6-week period in the worst case scenario.
So that's quite different than influenza, and this kind of goes on for quite a bit longer.
Absolutely.
Just in terms of if I have the test, how soon after I have the test will I know the answer? I mean, it takes a while to process these things. How quickly do they get the test turned around?
Yeah, so I should have mentioned, at the beginning, you were only testing through the public health lab. There is efforts underway to have other laboratories around Toronto and I think around the province to start doing this testing, and I believe some of them are already online with testing. The Unity Health Lab is working towards that as well. And so there's sort of 2 countervailing things that are happening here. As the number of people tested rises, the amount of time to get your results takes longer. But then as more labs and increase their capacity to test those numbers come back down. And so at the very beginning, when the public health lab was just getting started, it was about a 6-day turnaround time. they got that down very consistently to under 24 hours. But right now it's creeping up again, and we're seeing 1 to 3 days to get results from people, I think because the volume of testing has really increased dramatically. But many of the other labs are not yet ready to test. I'm hoping that as they come online over the next week or two, those numbers would come back down. I think we are aiming for a 24 to 36 hour turnaround.
So there are more labs trying to come online.
Correct.
Is St. Michael's lab doing the test?
They're not doing it yet, but they've purchased the equipment that would be required to do it, and they're, I'm not sure if it's been delivered yet. You're nodding. It may have been, once the equipment arrives, and it may have already arrived, they need to validate it and do some work in the background to make sure it's equally accurate to the public health test, and then they can go live with that. And so that may be a week or two away. So
I want to move on a little bit and talk about treatment. So when will there be a vaccine? I mean, will there be a vaccine? And
Yeah.
if so, when would we likely be able to see it?
So, the optimism of people is amazing. And, the vaccine experts seem to think that there will be a vaccine. I'm not a vaccinologist, so I'm not sure how they know that there will be a vaccine. There's certainly other conditions for which we've sought a vaccine for a long time and been unable to develop a vaccine. But I think the world, the attention of the world's researchers is really focused on COVID, and they're very optimistic that a vaccine can be developed for COVID. So I believe them. I think that's true. They're also, they're also strike a note of caution that to ensure that a vaccine is effective and safe takes much more time than the general public appreciate. And so they're really saying 18 months from when this started is the shortest possible time before there'd be any access to a vaccine by the general public. But my understanding is there are already what they call vaccine candidates that are being tested in either animal or very small human populations. Probably the initial thing is to make sure they're safe. And then when they see they're safe, they then try to figure out if they're effective at preventing the coronavirus. But based on what I've seen with vaccines in the past, often the first candidates aren't as effective as you would like, and then you have to keep working at it. But there's hope that there will be a vaccine, but it may take time. It's another reason why it's useful to delay things in populations that are able to do that for as long as possible to get closer both to vaccines and any type of proven treatment for the disease.
What about antiviral drugs?
Yeah. So antivirals are a little different than antibiotics. Antibiotics tend to work across a number of different bacteria, and antivirals tend to be much more focused on a very specific virus to do with the way that they work and how viruses are related to each other. So, for example, oseltamivir or Tamiflu is really a treatment only for flu. It doesn't work against any other virus that we know of. Now, people have tried it with the coronavirus, but so far there's really no evidence that it works. We have a number of antiviral drugs for Ebola, for HIV, for flu that people are looking at to see whether they might work on coronavirus, and some suggestions that some of these things may have an impact in animals. I think I'd be very cautious here. I don't think that we have any evidence that any of these drugs work yet. And the appropriate way to use them is in clinical trials, which are already ongoing. So my understanding is there's between 80 and 90 clinical trials that were set up, some in China, and I expect they're now moving to Italy and the US and other hotspots, trying to find out if these drugs work. But right now, the safest thing right now is probably, to be honest with you, no treatment, because these drugs can also have side effects and harms that we don't understand. And so there's no secret drug that doctors are hiding or giving to select patients. We really don't know if any of these drugs work, and the right way to find that out is to give the drug to one person and not to another, and see if it makes any difference.
So it's not really a treatment, but there's this notion around, because of the flu, that warm weather helps. So is there any evidence that, like flu seems to be a winter bug, and in the summer kind of goes away as it kind of rotates around the world? A lot of the people on the line here probably have a home in Florida where it's nice and warm, and we're cold here. Does that make a difference? Is there any evidence that helps or hinders? Or
Sure. So I actually can just expand on my last comment about treatment. So there's no antiviral drug for COVID that we know works, but I will point out that outcomes have varied very widely from one area hit by COVID to another. And what that really has taught us is that the supportive care that you can get at somewhere like Unity Health makes a huge difference. So if you can have an intensivist and a nurse and a bed and a ventilator, best possible care, which is supportive care, the outcome can be much better. And if you are lined up to get in the hospital and they're not letting people get full, then the outcome is quite poor. And so that makes a big difference. And so I'm just emphasizing that because it's really important that we not overwhelm the healthcare system. And this is again going back to the idea of social distancing. And if we can slow the train down, it won't hit as hard. Essentially. So it's not that there's no effective treatment. It's just that effective treatment is the basics. It's giving people oxygen, fluids, to monitor them in a healthcare setting, watching for complications, and treating things like kidney failure if that develops. In a good hospital, and if the staff there aren't overworked and can pay a bit of attention to you, the mortality is actually reduced quite a bit. And if you're in an overwhelmed healthcare system, then all bets are off, unfortunately.
Yeah, and so I guess that actually, if you expand that a little bit, a lot of our folks on the line here travel to all kinds of interesting places in this world, which are, we all would love to go and see. Often those places actually don't have a robust healthcare system. So if you get sick there,
yeah, and
these kinds of supports may not be available.
Yeah, that's a good point. And I was telling people much earlier in this that you normally don't go from a bit of a cough to being in the intensive care in 24 hours. And so, but in actual fact, if you do get sick, it's going to be difficult to travel back to where or travel somewhere safe. And so I think that is a good reason to think about travel plans very carefully.
Yeah, so you need to be near an excellent healthcare system that can care for you if indeed you do get sick. So I think that's important for people to understand. And I guess we've talked a little bit about the notion of overwhelming the hospital. I think a lot of people are worried that this will blow big time and the hospital's going to be into triage. This whole notion of we don't have enough beds, we don't have enough ICU beds, we don't have enough ventilators. And you've talked about decreasing the peak through all of these strategies, stopping large group events, this social distancing, which may not in the end result in fewer people contracting the virus, but will lower the peak, which means it will reduce the risk that the hospitals will be overwhelmed at any particular time.
Correct.
Is that right?
Absolutely, absolutely.
So the notion is the area under the curve, and the number of people actually end up getting it may be the same, but if you spread them out, everybody's going to do better, and the system will be better able to cope with it than if you sort of push it all and get it all over in 2 weeks. That's not a good thing.
Exactly. Every healthcare system, even the best systems, have a maximum capacity where they can safely operate, and we don't want to go beyond that. And so flattening the curve really will make a difference there. Also, of course, for the people at the tail end of the curve, they'll benefit from all the research that's being done. Maybe there will be an effective treatment, maybe there will be a vaccine, and so things can be, if we stretch it out even longer. And that comes back to the question of the warm weather. So, unfortunately, I think this idea that it will get better in the warm weather is pure speculation that all of us want to hold on to. I think that there's a few reasons why there may be some plausibility to that. So, for example, this is what happens with most seasonal respiratory viruses. The reason for that is not fully understood. Different hypotheses include changes in the humidity affect how far the virus travels when you cough. The fact that when you're outdoors more, you're less, it's a form of social distancing. So when in the winter, maybe you're more likely to be in a movie theater or in some crowded restaurant, and then in the summer you're picnicking or out. But that doesn't fully explain it, because this occurs even in countries that are fairly mild temperatures all year round. And then there's also an effect of everybody going back to school in September that may be part of why viral season takes off after that. So they all come back from their summer vacations and then start spreading the disease among children. That's how flu spreads, really, is among children and then out to adults through the children, which is not interestingly what happens with this coronavirus. And so I think it's optimistic to think that the summer will make a big difference. Maybe it can make a little bit of a difference. I think from a Canadian perspective, what makes a far bigger difference is what's happening in the U.S. the U.S. that can get things under control, that will have a knock-on effect here. If there's an exponential growth of cases in the U.S., then there's going to be a problem here related to that, and that will drive this much more than seasonal change.
Just now that you've mentioned the notion of number of cases, Angela Merkel, Chancellor of Germany, said she expects 70% of the population in Germany is going to get this virus. I guess our health minister the other day came out and said, well, in Canada, we think somewhere between 30 and 70, which is a big range, but even 30 is not a small number. So people are saying these are large numbers of people that they're predicting are going to actually get the virus at the end of the day. Do you agree with that?
I agree with it in principle. So if you expert epidemiologists and mathematical modelers have models of how infectious diseases spread, and usually what happens, for example, with flu, is each year there's a new strain of flu. And so people have different levels of immunity to the new strain, because the new strain is related to the old strain, but not exactly the same. And so when there's more, each year there's more susceptible people because some people's immunity has waned. There's some new people that have been born who don't yet have any immunity, and that triggers the outbreak. And then as the outbreak occurs, people develop more and more immunity. And at a certain point, you get something called herd immunity, whereby there's less risk of transmission. So when you put a new person with a new virus into a population where no one has any immunity, you have to get up to like 70% of the population infected before that's enough herd immunity to really shut down the epidemic. But that's assuming that there are no efforts made whatsoever to control the virus. So that's assuming that everyone's going to basketball games and everyone's going to school and everyone's still shaking hands with each other and hugging and kissing in public, as is common in Europe, for example. And so I think we really can do better than that, but how low we can drive that number is uncertain. I think there is some very optimistic information coming out of China. So again, the outbreak started in Wuhan, which is in the Hubei province. And so Wuhan was hit very hard. And the Hubei province was hit fairly hard as well. And that was largely, they were the first people in the world to have to cope with this. And it came upon them, largely unprepared and with no forewarning and no test for it at the beginning. But the rest of China, which had just a little bit more time to prepare, has actually done extremely well. And when we look at the fact that there's sort of 80 or 90,000 cases in China, and it's a population of 1.4 billion, and the epidemic there seems to almost be coming, towards a close outside of Wuhan and Hubei, I think it can give us optimism that this can be delayed. Now, it may be that this is a pause in China, and they may see increasing number of cases again if they're not vigilant, or, for example, if they start to relax all the social distancing that they're doing. But I think it does suggest that we don't have to hit 30%. And it will be interesting to see what happens in Italy now that they've imposed, again, very stringent measures to kind of try to keep people separate. They did that, unfortunately, too late from my perspective, but it still should make a difference. Because the incubation period is 14 days, you can't tell if anything like that is working for at least 14 days, which is why it's really important to start these things a bit early before you think you have a problem. And one of my colleagues at the hospital described this as trying to drive down the highway where you only can look in your rearview mirror, right? So you can say, well, we don't seem to have too much of a trouble today and the traffic seems okay, and not realize that you're about to crash into the truck that's right in front of you. And this is a disease that increases exponentially. So, it's been pointed out several times that, Italy has tens of thousands of cases, but 3 weeks ago they had, 40 cases or 100 cases. And so when you don't do anything to control that, that's what can happen. But I don't think it has to happen if we take the right steps. And it's not a matter of Italian authorities not knowing what to do, but I think it's a matter that we're the second or third country hit. And if we can be the 50th or the 100th and learn from those experiences and take public health action earlier, and I think I'm seeing the right things being done right now, I think, and the right thinking happening. No one knows exactly what the right, people are arguing, were we too early to close schools in Ontario? I think these certain things, schools are particularly difficult because they affect a lot of adult workers that can have a negative impact. But the basic idea of closing down hockey games and stuff, I think, makes perfectly good sense and may help us as we go through this.
So if I get COVID, am I immune?
So getting it again?
Yeah, I mean, almost everything we know about viruses would tell us that if you get COVID, you're either going to be immune for the rest of your life or immune for a substantial period of time. And we don't yet know which of those two things it would be. And if it's only for a period of time, like say 6 months, that you're immune, it's very likely that if you were to acquire COVID again, it would be a much milder illness. And so, again, this is purely speculative, but some people think that, 3 years from now, COVID will be just another disease like flu, because we'll have all had it twice, and each time you get it, it'll be milder, you'll be building up immunity. But it's also possible that we'll only get it once, and then that will be that. So I think we don't know that yet.
So that's the notion of, like, the flu kind of mutates.
Right.
So is this one likely to mutate and sort of do the influenza thing, which is every year it comes back, but it's different? So, we're all at risk, and we have a new vaccine, which is they try to get it close to the active.
Yeah. I think
is it going to be like that, or is this going to be different?
Yeah. I think we don't know. I think it's interesting that there are other coronaviruses that cause a common cold type symptom, and I don't think we know where they came from. So it's interesting that all three of the new coronaviruses, both SARS, MERS, and COVID, seem to have come from bats. And so, it'd be interesting to know if those older coronaviruses maybe came from bats 300 years ago, before we had modern science to understand what was happening. And perhaps they caused severe illness that then mutated and became milder as people, they mutated and developed immunity. Just to mention, another thing that can happen with these viruses is the virus that will spread most aggressively is the one that spreads best, not the one that's the most severe. So often a milder virus will spread more, both because the person feels well enough to go to work and to go out and infect people, and because they don't die, so they can continue for their whole period of time spreading the virus, whereas a rapidly fatal virus dies out because it doesn't get the opportunity to spread. And so for that reason, there may be a selective advantage to strains of COVID that are milder, and so over time, that's another reason why we may see milder and milder disease. But right now, this is pure speculation.
So does anybody have any sense for how long this is going to last? Like, we're now into, canceling major public events, schools out. Is there a sense for how long, best case scenario, and we're trying to shorten the curve, lengthen the curve, right? So, I mean, one way would be to let everybody get it all tomorrow and be done with it. And move on, but of course that would overwhelm our healthcare system, and a lot of people would probably die unnecessarily. So by spreading it out and slowing it down, we save lives and keep the healthcare system intact, but we also potentially prolong this thing. Is there any sense for how long we're looking at this thing before we're kind of able to get back to normal?
Yeah.
A lot of companies have gone to work at home. I mean,
yeah,
maybe they'll never come back, but is there sort of a sense for the end in sight sort of thing?
Yeah. So unfortunately, I think the only thing I can say for sure is that it's going to get worse before it gets better in most areas. So, Italy may be at its worst point, and China may be on the road to recovery. But everywhere else, I think, has not yet seen the worst for their area. So it's going to get worse before it gets better, and it's still going to be a big issue in Canada, sort of 3 to 6 months from now. I don't have too much doubt about that. Exactly how long this lasts is hard to know. Again, the place that's been dealing with it longest is China. It started there in early December in a sort of limited way, or when it was very first recognized, and it's still an issue there now in March. Although, like I said, in most of China outside of Hubei, the different regions of China that have millions and millions of people in them often report 0 new cases over a given day, but they're still, testing people, monitoring people, and they still have social distancing, in place in those areas. And so, this is not something that goes away 3 months from now, and we're not even at the point that Wuhan was at the beginning, right, in Canada. But again, we have the advantage of acting early and having a test available before the epidemic starts here, and knowing a little bit about what worked and what hasn't worked in other places. And so, maybe I'm being a little overly pessimistic, but for sure in 3 months, we're still going to be grappling with this.
So this is going to go on for a while.
it's going to be an issue for a while, whether it's a worse and worse and worse type of issue, or whether it's sort of we're able to stabilize it. But as long as it's happening, it's an interconnected world, and so we can't let down our guard or vigilance as long as we don't have the vaccine. Most Canadians are not immune, and this is going on in any other country, right, around the world. And
come back. So.
Yeah, and right now, each day, it's an increasing number of countries recognizing that they're having a problem.
So we're getting near the end here of our hour, Matthew, and people have sent in. I've got a number of questions that have kind of come in as we're talking. I mean, I guess one would be, just things like, can I go for a walk in the park? I mean, is it safe to go outside?
Yeah, it's interesting. Like in some of these countries, they tell people, I'm not sure if it's a translation issue, but they say don't leave home and don't go outside. But I think that one of the best things you can do, from my perspective, if you're actually say self-isolated or if you're social distancing, is to take a walk in the park and go for a hike in nature and away from people. Really, these diseases tend to spread in indoor environments. They tend to be on doorknobs and tables, utensils and plates, and then that's where people are crowded together and sitting 2 or 3 feet apart. So, taking the dog out in the park, maybe don't sit on the bench with somebody with a runny nose, but really I think that you're probably fine outside.
What about folks traveling? So if I'm coming home to Toronto from Florida or, Spain, it's not a hot spot yet, should I be self-quarantining myself?
Actually, Spain is a hot spot, just,
Oh, okay, sorry.
Spain is a hot spot, unfortunately. I think, so first of all, you should check, depending whether you're going to the US or Canada and so forth, you should check the public health website at your destination to find out, because there are certain countries where it's not really a choice, and they're going to tell you to self-quarantine for 14 days. For example, if you're coming from Iran right now, or Northern Italy, or Hubei, China, you would be required to do that. It's always, people can try to slip out from their quarantine, but they shouldn't be doing that. But I actually do think it's a good idea right now for most places to whether you're sort of fully self-isolating or really aggressively socially distancing when you cross a border into Canada. I think that's a good idea.
So what about the United States? I use Florida. We've got a lot of people on the line, probably have homes in Florida. They're coming home.
Yeah.
They may be on the line from Florida right now, thinking about coming back to Toronto.
In the countries that have the biggest problem, one of the ways you can recognize that is they cause problems outside their own country. So at the beginning of this, all the cases we were seeing in Canada were people that had come from China. And then the next thing we saw was a few Iranians, and they were picked up really by astute clinicians because we weren't screening for people coming from Iran, but something about the case that triggered a test, and then we realized that, so we knew there was a problem in Iran before the Iranians, because you have to have a lot of people in Iran who are sick before somebody coming to Canada from Iran is likely to be positive. And after that, we started seeing Italian people coming from Italy, both Canadians and Italians coming. But recently, we're diagnosing people from Hawaii, from Colorado, from New York, and so I think the problem with testing in the U.S. means that they don't have a good idea there of the number of cases that are circulating, and because 80% of them are mild, you have to get up to a certain critical size before hospitals are aware of the fact that there's a lot more sick people coming in than what they expected. So I don't think the U.S. is fundamentally different anymore than Spain or France or other countries that have a more clearly defined problem. And you can see the case counts in the U.S. rising rapidly as they are starting to test.
So to be specific, are folks coming home from Florida?
I think if you're coming home from Florida, you should self-quarantine for 14 days, yeah.
Okay. Other questions? What have I not asked you that I should have asked you, Matthew? You're getting asked a lot of questions by a lot of folks, and
yeah, I think that was I think that was a pretty thorough kind of thing. I didn't talk about disinfection, and so again, for the household, it's kind of common sense stuff like household bleach or some type of disinfectant for the bathroom and cleaning kitchen surfaces and that kind of thing, especially if somebody in the house is sick, is a good idea. Don't need to go overboard with that, but I think it's something we didn't talk about. Otherwise, I think we've covered most of the bases there.
I guess, and if we go back to St. Michael's is kind of getting organized, or it's been getting organized for quite some time, and sort of moving towards sort of restricting access. So we're not screening at the doors yet, but we're telling people who've traveled not to come to the hospital unless they're coming to be a patient. Staff who've been traveling outside the country have to be assessed before they can come back to work. Foundation board members have been asked not to come to any St. Michael's site, whether it's the hospital main site or this site. We're in the Manulife building, which is next door to St. Michael's, but this is St. Michael's space, so we're asking board members not to come here who've traveled outside of Canada. So your sense is we're likely going to be even increasing those in the next little while, those screenings, like actually stopping people at the door and not letting them in if they're had any kind of travel history or anything at all that might trigger a concern?
Yeah, I think the hospitals will be moving very shortly to screening at the door, and really just the logistics of that are being worked out so that patients, visitors, and staff will be screened at the door likely going forward.
All right, well, we're at 9 o'clock and we've covered a lot. So, and I've kept you talking the whole time, Matthew. So on behalf of all of us on the line and here in the room, thank you so much for doing this. We really appreciate it, and I suspect folks are a lot better informed than they were before. Maybe not all of this is happy to hear, but I guess knowledge is power. It gives you opportunity to do the right things and keep yourself safe and your family and loved ones. So important to have this knowledge. So with that, thank you very much, and we'll sign off.
Okay, thanks very much.
All right, we're done.
Thank you.